So let's say you are a nurse who's been in the field for a while and you're looking for a job that is more suited for you. I've found that those high stress jobs in hospitals where you're running around for 12-hour shifts are pretty challenging the older you get. So there's some other job options out there, and that's one of the amazing things about a nursing degree is its flexibility. And it's your degree and you paid for it, so you might as well leverage it as best you can for yourself and whatever season of life you're in. So here are some options of jobs for older nurses. Number one, telehealth. This is an emerging specialty in the healthcare world, and it's actually a pretty great thing that I think that hospitals are implementing, and even outpatient clinics. So what you do, if let's say you wanted to work in a telehealth ICU, that's a thing now, which is incredible. You are in a room with a bunch of other nurses who are on a computer, and you are looking at the charts and vitals and things of patients remotely, and you're able to run protocols, check orders, double check various things, charting things for the nurse who is physically at the bedside. You also can do telehealth nursing in an outpatient setting as well. So this is great. You're on the computer, you're not running around, but you're still using those high-level critical thinking skills. And I think this is a great option for people as they get pretty worn out of working at the bedside. So telehealth is certainly something to look into. Not available everywhere, but is certainly emerging. Another option is procedural centers or infusion centers. So in these areas, you will definitely be still using your clinical skills, starting IVs, giving medications, talking to patients, but you're not running around a large nursing unit. Codes are not really happening that much. I mean, you may have some situations where a patient suddenly starts to not do well, but that's the exception and not the rule. You're not doing bed changes and total care situations and walking people. You're getting people prepped for surgery, or you could even be in the one-day surgery center where it is an outpatient procedure, or you're in an infusion center. Still using those skills, but not really running around a unit for 12 hours. Dialysis is another option. You could work inpatient or outpatient. Nice thing about dialysis, again, you're using your clinical skills providing care, but you're not doing the 12-hour shifts running around a unit. You're with a few patients in a local area where you're right at their bedside running the machines, and then checking them out, doing your assessments, still doing documentation and everything, but it's less physically demanding. Another job option is something like utilization review or working for an insurance company. This is doing things like reviewing charts, making sure that whatever healthcare services that are being used, have been used, are appropriate, the most cost efficient. You're talking to people on the phone and working through paperwork and things. So it's a job where you're using nursing skills, but it is one where you can even work from home or work stationary at a desk. And finally, you could always go to outpatient nursing. So this one, you are walking around a little bit more and you are in a clinic setting, but your responsibilities as an outpatient nurse are very different than an inpatient nurse. You're not providing 12 hours of direct care to total care patients. A lot of what you're going to be doing is on the computer and on the phone. You're going to be talking to insurance agencies, you're going to be talking to physicians, you're going to be talking to patients on the phone, and instead of performing a physical assessment at the bedside in the hospital, you're going to be talking to patients on the phone and trying to understand clinically what's going on with them by talking to them and not being able to see them. It's a very different kind of challenge, but it's definitely using your nursing skills nonetheless. And the nice thing about clinic nursing is the better hours, the 8 to 5 situation, no holidays, no weekends, and those are definitely much more sustainable, I think, than those 12-hour shifts on your feet. So those are some options for those of you who are farther into your career and looking for something that's less physically taxing. So to review, the different options are telehealth, procedural centers or infusion centers, utilization review, dialysis, or outpatient care. So thanks, nurses, and stay fresh.